I'm Dr. Parinitha Reddy. I'm a pediatric oncologist working at Yashoda Hospitals, Somajiguda. I'm an Usmania student. I trained and worked in the UK for 11 years, and I've been back in India for the last 13 years providing services for children and adolescents with blood cancers, solid cancers, and blood disorders. I'm having more than 20 years of experience in treating children and adolescents with cancers and blood disorders.
So welcome to the program, Doctor, and it's a pleasure to have you.
Thank you.
So pediatric oncology, I'm sure it's such a demanding field, yet a deeply meaningful field. So can you take us to the beginning? What inspired you to choose this path, and how has this journey shaped you, both as a person and as a doctor?
When I was training in Usmania General Hospital, when I was doing my internship, so there was a child with acute leukemia, that is a type of blood cancer, and parents were, they traveled a long distance and got the child. Parents were ready to do anything. So he was admitted on the day of my internship, and then he passed away on the day I left. So in 1 month, despite doing everything. So then I thought, why did this child die? When the textbooks say that, the 90%, 80% of these children are surviving. So why is this happening? It's not just that child. The general trend of children was that in the public setup. So I wanted to train myself in pediatric oncology and then bring back the expertise here. When I looked around, this training was not available in India. So I went abroad. I went to London and worked and trained there for 11 years. And then I wanted to come back and make a difference here. So it's been 13 years that I've come back to Hyderabad, and I've set up the pediatric oncology services and treated many children and adolescents.
So that was your light bulb moment, I believe, when you realized, okay, this is what I'm meant for, isn't it?
Yes.
So I'm sure, dealing with cancer, at any age group, it's tough. But when your patient is a child, I'm sure it's more emotionally vulnerable. So how do you handle that?
So when a child comes, it's not just a child. The child comes as a package. So by that I mean, we are not treating just the child, we're treating the entire family. So it's the parents and 2 sets of grandparents, siblings involved, cousins and everybody. So we have to be very sensitive to that aspect first. So, and it's like, any diagnosis like cancer or a serious blood disorder, it's like, throwing an atom bomb on that family. The life turns upside down completely. So we have to be sensitive to that aspect also. And half of the things which we tell them, they don't understand in the beginning. So we have to take it slow. Now, the first thing we tell them is, don't worry, it is curable. So that is what I ask my the parents to actually hang on to. That is the hope. So because most of the children's cancers are curable, it is actually a very, very, fulfilling position that we are in, that we're able to give the state-of-the-art services to these children in India in 2026. We're able to give everything to them that, that's that latest advancements here. And we're able to cure most of the children. And our results are on par with the Western countries. That is the best part of my tenure in India.
So when we talk about cancers, so it's usually in adults, this is probably the first time I'm doing a podcast with a pediatric oncologist. So cancer and children, how do they go about? Is it real?
Whenever I say I'm a pediatric oncologist, people look at me like as if what? And then I have to explain myself quite a lot. So children do get cancers, and it's important to be aware of it, because if we are not aware, we don't pick them up in time. So this awareness helps us pick them up on time so that we can give the treatments, and then that will have a big impact on their outcomes. So if we pick them up early, even the treatments that we give are less intense. And so we are giving these treatments to growing children. So we have to think about what is the effect they're going to have on their life as well. So we can reduce late effects as well. And the most important thing, it is not all, despair. There's a lot of hope. Most of these cancers are curable, and children tolerate treatments much better than adults. And we shouldn't treat them as small adults. Children are not miniature adults. So their cancers are different in biology, the way they behave, the way they respond to the treatments. Everything is quite different, including the outcomes. So they have the best outcomes.
So you're mentioning that the cancers are different in children compared to the adults. So what are some common cancers that we usually see in children, and what are the treatment options which are available?
So the most common cancers which see in children are blood cancers and cancers of the lymphatic system, followed by brain tumors, neuroblastomas, kidney tumors, so on and so forth. And usually the treatment options when it comes to the treatment, most of them is medical treatments, especially for blood cancers. And the medical treatment is called chemotherapy. And we also go for surgeries in solid cancers, and radiotherapy is rarely necessary, which we have to take up based on the staging of the child. And the latest modalities of treatment like immunotherapy and bone marrow transplant are also part of the treatments. This is one aspect of treatment. The other aspect is the supportive care. Supportive care includes how and when we pick up these infections, because these children, the disease and the cancer itself and the treatments that we put make them more vulnerable to serious infections. So in a country like India, it is even more, they're even more at high risk of infections and resistant infections. So education around infection control, prevention and prompt treatment of infections is extremely important. So most of the time the children are spending in at home. So we have to educate parents, and it's a long drawn process as to how to look after these children at home and when to seek medical attention immediately.
But let's just get to the basic. Why do children get cancer? Is it always because of the genes which is running in the family, or something else?
Yeah, that's a good question. Usually, most of the time, we don't know why they get it. So, in about 5% of the children, there can be a genetic predisposition. Like they can have something like a DNA repair disorders or Down syndrome, which actually predispose that particular child for an increased risk of cancer. Apart from that, usually in adults, we see a lot of risk factors like smoking, addictions, and a lot of other issues that can predispose. And aging itself is a risk factor for cancer. But in a child, we have none of that. Yeah. And the exposure is not long enough, not long enough. So most of the time, we don't have an answer, although tremendous research is going on this aspect.
So when dealing with pediatric oncology or children cancer, what are some common myths, doctor, that you usually come across and that you would like to clear up?
One is, do children get cancers? Yes, children can get cancers. Even a newborn baby can be born with cancer, but these are extremely rare. So if there are 100 individuals affected by cancer, only one of them is a child. So I would say 1% of all cancers are cancers in children. So that is a good news. So it is not common. And other thing is whether children tolerate treatments. So a lot of parents ask me this question, oh, he's just a child, how will he tolerate? So most of the time children tolerate treatments extremely well, much better than the adult. And they recover very well, they respond very well, they recover very well, and they bounce back like anything. So that is the best part of my journey with these children. So they bounce back and they make it, they come out. And do these children have normal life? So that is the other thing. Can they be cured? Yes, they can be cured. Most of them can be cured. When I came here 13 years ago, the awareness was limited and there was a lot of issues. But now in 26, there are a lot of centers which are offering treatment for children with cancers. There are a lot of trained people, and these units are focused in treating children with cancers.
So do you see a big change?
Yes, a lot of change. From where I started, it was a steep learning curve and a steep curve for me to make people even aware that, children need to be treated in dedicated pediatric oncology units. That was a big thing. In units like ours, where we are able to offer the state-of-the-art treatments for the children, we are seeing survivals on par with the West. Okay. So that is the best thing I can say in my entire tenure in India. That is the happiest thing for me.
Another common myth that we parents usually ask is, can junk food and eating too much of sweet, does that cause cancer in children?
See, as of now, we don't know, but excess of junk, party food as we would like to label it, and excess of sugars is not good for anybody. So I would say to avoid, to limit it to a weekend or something like that.
So you were mentioning, that awareness, especially for parents, is very important. So what are some subtle signs that we usually miss because we think, children and cancer is not happening?
That's a very good question. Now, important thing is to be aware. So not only the parents, the health professionals too.
Yeah.
Yes. So any symptom that does not go away has to be evaluated. So what I mean is, children's cancers are varied and the symptoms depend on the site where the problem is. So most common is blood cancers, and so any fevers that don't go away beyond a certain limit of time. Usually fevers in children go away in 3-4 days time and maximum 1 week. So if it goes on for more than a week, 10 days, and if there is persistent fatigue, they're tired, pale, or there are any bleeding symptoms, or lumps and bumps which are growing and they're not going away anywhere in the body, and persistent early morning headaches. The child is getting up from sleep with pain, which can include a headache or a bone pain, back pain. These are not common in children. So the uncommon symptoms in children that don't go away, we have to evaluate for possibility of cancer. I'm not saying that they all have cancer, but we have to look at it, especially a point about brain tumors. So these are the second most common tumors in children. So the symptoms are persistent vomitings, early morning headaches, and seizures, sometimes means fits. Very rarely loss of consciousness and things like that. So, and a new onset squint. So these are the symptoms that the parents and the health professionals have to be aware of. Usually these children present repeatedly to the healthcare professionals, but because of lack of awareness, sometimes the diagnosis they won't be evaluated. And if this diagnosis is missed and we pick it up at a later stage, the outcomes are not as good.
So on the occasion of International Childhood Cancer Day, ma'am, what is that one powerful message that you would like to share with the parents out there?
పిల్లల్లో క్యాన్సర్స్ అనేటివి అరుదుగా కనపడుతుంటాయండి. కానీ భయపడే విషయం ఏమాత్రం లేదు. ఎందుకంటే క్యాన్సర్స్ ఇన్ చిల్డ్రన్ ఆర్ హైలీ క్యూరబుల్. అంటే 100 మంది పిల్లలకు క్యాన్సర్స్ వస్తే 80 మంది పిల్లలు పైగా నయమయ్యే అవకాశాలు ఉన్నాయి. నయం అవ్వడం అంటే డిసీజ్ డిసపియర్ కావడమే కాదు, వాళ్ళకి క్యూర్ అవ్వడము, లాంగ్ లైఫ్, నార్మల్ లైఫ్ లీడ్ చేసే అవకాశాలు చాలా మెరుగ్గా ఉంటాయి. సో కానీ దీనికి కొన్ని ప్రిరిక్విజిట్స్ ఉంటాయి. ఎర్లీగా డయాగ్నోస్ చేయడము, రెండోది ట్రీట్మెంట్ సరిగ్గా ఇప్పియడము, డెడికేటెడ్ పీడియాట్రిక్ ఆంకాలజీ యూనిట్స్లో ట్రీట్మెంట్స్ కనుక ఇప్పియగలిగితే మీకు పిల్లలకి నయమే అవకాశాలు, బాగయ్యే అవకాశాలు చాలా బాగున్నాయి.